Thank you so much for coming here to see the launch of the film Scotland African Voices, COVID-19 Vaccine Debate. After Scotland African Voices premiered in 2022, we had further talks in different Black communities to discuss the research and the film. We also brought up the topic with our politicians in the Scottish Parliament. Thank you for graciously agreeing to host this event here, Scotland African Voices, the Scottish Parliament film screening, and for inviting your colleagues to join us here today. I also want to thank all the community leaders and individual members of the African community. They have contributed immensely to the development of the film, but also to the dissemination and the communication and engagement that's ongoing within the community. Now, the Black Scottish community is a vibrant, is a diverse, talented, and most importantly, very educated community. Our research suggests that 70% of the community members have at least a first degree, and another 7% have at least a PhD qualification. So it's a very, very talented community. We are very proud of our Black heritage, but at the same time, our Scottish identity. And we look forward to continue to contribute our best to the Scottish economy with our culture, our talent, and our food and style and colour as well.
My name's Bob Doris. I'm a member of the Scottish Parliament for Glasgow, Maryhill and Springburn. And when I was approached by Josephine to sponsor this afternoon's event, I was very keen to do so.
Before gathering today, we've had 5 community discussions across Scottish cities in Glasgow, Aberdeen, Edinburgh, Stirling and Dundee. Now, the research itself revealed some troubling connection between vaccine inequity and societal inequity. So for us to begin to address any vaccine inequity, we need to start looking at how to address societal inequity as well.
One of the things I was also always struck by was the positivity of communities to address structural inequalities, but the real frustration of the lack of action and the key need for self-empowerment from communities at a grassroots level to take the action forward to the heart of government. And I hope the work of Dr. Josephine Adekola and the partnership can lead to some of that taking place.
Good afternoon and welcome to Committee Room 1. I'd like to welcome everyone to the Scottish Parliament.
Thank you so much for having me. It's a pleasure to meet everybody here. So just to tell you a little bit of my research. So I began to research COVID-19 vaccine engagement following the news that some communities, specifically the African, Caribbean and Black communities, weren't taking up the vaccines. And I was quite interested to understand why that was the case. That's why we're here. We're academics. I'm a member of the community and I was curious to know.
During the COVID-19 pandemic, the issues we had with vaccine hesitancy was disproportionately felt by a lot of Black communities. And the lesson, of course, for policymakers is if you haven't built up trust with communities in the first place, is it any surprise when you ask them to do something substantially different than we've ever asked people to do before, if some people might be a bit hesitant in relation to that, if you haven't done the hard miles in building up that trust in the first place.
Most of the African people in Scotland today, first-generation immigrants. And what that means is, some of them are students, some are refugees, some are asylum seekers, and there's a lot of restriction around what they can do and what they can't do, what work they can do, what work they can do, and that begins to push people into poverty.
A lot of people from the Black community don't have recourse to public funds on their visas, and most of them couldn't work as well. They didn't have access to benefits.
There's a disconnect between the government policy and the ground, where the rubber meets the road. So whatever decision is being made at the top, I don't know how they follow through to ensure that gets to the people, that decision is made on their behalf.
In their minds, they think that they are representing you, but deep down, you know what they're saying does not even relate with you. Like, what's that? What are you saying?
So if the top are not doing what the bottom is expected to do, then we have a big problem.
Even though we all speak English, our culture affects the way that we perceive the information that we receive.
I had a big meeting this morning actually with the UK government. I was really trying to press many of the points that I've just heard about how unfair the system is, how differently certain groups are treated in the UK, particularly based on arrival, based on nationality, point of origin. It's incredibly wrong, and you're absolutely right to say that's not a fair country, and we want to be a fair country.
I did 3 series of research to try to find out the reasons why people weren't taking it. And the general broad themes were around issues of misinformation and disinformation with the social media, making it even more impossible to discern what is the correct information, what is the wrong information. So that was pretty much a challenge. Within the community, there were a lot of conspiracies, from religious conspiracies to conspiracies around lab rats, from historical unethical practices from the past. There were a lot of fake news, and people were resharing it without even asking questions or putting a label to say that this was fake news. So people were receiving this disinformation, misinformation, fake news, conspiracies, and it was shaping how people were receiving the kind of information that Jason was sharing with the public.
If there had been targeted message educating us specifically, not general message in the way they normally do it, but understanding and appreciating that the United Kingdom is a diverse country, and so that people can engage with it.
How do we get into engaging more women to be able to, spread the messages? How do we approach the younger generation? Because they would be the one picking up. How do we target them, educate them from now on to be able to, prepare for the future?
There was also a lot of issues around distrust. And distrust, one of them emanated from the fact that the science itself was changing. So they changed the emergence of COVID, and the messaging itself was a problem. Now, in the third study, one of the things that was really surprising was the fact that people's disengagement with the messaging was linked to issues around discriminatory practices and racism.
I'm one of the persons that didn't take the vaccine. Primarily, I felt that the system wanted me dead in any case. So why do they want me to go and take a vaccine? And that is from my experience. Because I had a case that was going on at that time, and the case had run for, at the time, was like 6-7 years, where the Home Office had held my papers for such a long time. Each time we go to court, we want to go to court, they will withdraw the case for reconsideration, and they wouldn't give me the visa. And I'm not allowed to work. For a country that will not allow a human being to work, right, for years, not 1, not 2, not 3, not 4, not 5, not 6, and the country comes up and says, oh, come and take vaccination. You just look at them. Is this for real? You have wanted me dead long ago.
All my IDs were sent off to the Home Office. I couldn't even leave the expensive house to rent a cheaper place. And I was forced to be paying that high rent just because the leasing company needed my IDs that were with Home Office. Home Office gave me nothing to show that I had my IDs with them for years. And my papers were also held there for many years. What happened? Withdrawal. Go take medication, I'm not going. Withdrawal is the final thing that we do.
So if someone says, as a human being, you should not earn a living, not that you've done anything wrong, you only have a case with them, and they stopped you from working, is that justice? And that same person turns around and says, oh, there is vaccination, come and take it. But hunger can kill you. And this is something I have experienced for 10 good years.
When we want people to register for the vaccination, where does it start from? Go to your GP. Is that not where it starts from? And at your GP, they are going to be asking for your visa. And so what do? You don't take it at all. Because for you to get yourself registered with the NHS to take vaccine, you must produce your visa.
One of the key lessons from there is that when we speak or when we communicate public health messages, that people are more interested in the structural context of that message. So who is saying this? Why are they saying it? Are they speaking to me? And why should I listen to them? Can I trust them? So people's perceptions of systems, not just the healthcare system, immigration system, the education system, the housing system, all the social determinants of health were crucial in shaping perception from the health system themselves and how people receive those messages. So there are a lot of structural issues that shapes what is being said. And just to round up on this question, I would say that people don't really care what you're saying until they know that you care for them.
The policies that are made and we're told, oh, it will work well, you're incorporated into it, by the time it gets to us, it doesn't practically, apply. So somebody has been working for an average African, especially Nigerians, I can speak authoritatively about. An average Nigerian that comes to the UK has a first degree. Most would have the first degree at least. And you're coming for masters or PhD and things like that. And at the end of the day, you actually don't really know how you settle into the system, because you get a job, the job, you're not promoted, or you don't get the right job, you have to retrain, or you get a care job. A PhD holder in a lucrative area is a care worker. And so that affects the trust in the relationship. It then makes it difficult when other things come up, like the health situation, for people to trust the systems.
We did a survey recently, and over 75% of people that responded said they've got a master's and above. However, about 60% of the response said they earn less than £15,000.
If the things that are happening in your immediate environment point to the fact that you are not respected or that you are discriminated against, the first reaction will be self-defense. You want to protect yourself, your integrity. You want to look at yourself and say, this person is not better than me. So why is it treating me this way?
Representation matters. Absolutely. Representation matters. We didn't see African professors telling us that the drug is safe. We didn't see African politicians telling us the drug is safe. There's just no, our face is there.
We see things play out. In the US, in the UK, you talk about the leg on the neck, and you see all those things, palpable evidences that the whites are not really too friendly with us. And now that the people coming to tell us, okay, this is good for you. How do I trust the person that is telling me it's good for me when I know that you don't even protect my interest?
I just want to re-emphasize on what you said concerning the black people living in the slum. Fairness in a way that let everybody, let it be mixed. If the council said there is no houses in the city, let us be still, even the indigent of the city, let us be mixed out there. So if we start to see fairness and transparency in everything that is going on, I think trust will begin to build up.
For some of us who have not trusted the system in other areas, it affects the health also and affects virtually every other thing. So it's going to take a rebuilding of that trust to be able to come to a point where, in addition to what she's saying, then we engage, in other aspects. And it's going to take quite a lot, because many people have had experiences over and over and over again. So that's the way the trust thing works. It's not just NHS, but it has come from other areas and affects the current situation we're talking about.
The issue here is not just healthcare-related issues, but health-related issues in other areas, employment, housing, immigration. So there's a whole lot of issues that are confronting the black community that would need, a progressive way forward.
Because politicians will sometimes say, we can't take action on that because the power doesn't sit here. That's true, but we can still make representations on it, and we can still work in partnership with you.
And I hope that the First Minister, the new First Minister, has managed to get that message across that one of his main priorities for this government is to tackle the inequalities that we know exist. So that's why we're focusing not just on not being racist ourselves, but promoting anti-racism. We are building these structures that will allow us to be a truly anti-racism government.
Is the idea that just because you engage with one BAME network or one black network or one African network, that's not you tick the box. It's about active and ongoing engagement. And if the people in this room and your networks are not involved in that active and ongoing engagement, we have to make sure you're tainted into that as effectively as possible. So thank you very much for giving myself as an MSP the opportunity to advocate for that.
The starting point for rebuilding trust is having these difficult conversations, which is what we're doing today. This is not even half as difficult as it could get, but it's a good starting point. We do have people from diverse backgrounds, and again, we have to understand what influences them, what institutional logic is dominant in their life. Is it religion, for example? If it's religion, obviously those people tend to listen to, let's say, the pastors, the reverends, the priests in this context. For others, it might not be religion. It could be something else, maybe economic logic. I need to make money, therefore I take the vaccine and I move on with my life. So again, it's something we have to think about, and think about how to tailor the solution to specific groups within the Black community.
I'm a CEO of the Multicultural Family Base, and one of the things we really look at is language. So being able to have things in multiple languages is really important. But I also think that, you know, remembering that people come from very diverse cultural backgrounds, you need to approach people differently. And I think sometimes the difficulty is, as it was said in the film, is that if you're black or you're brown, people just think you're one homogenized group, and so they treat you all the same. I'm from the Caribbean, so I was born in Barbados. I'm different to someone who was born in Africa. Very, very different.
There should be more engagement with the charities that reach out to our community, like the Black minority. So engaging the charities so that we are involved from the onset on how to tackle, because we know the people, the community that we work with.
In the circle where I come from, the religious leaders usually have a lot of influence over people, and people usually will congregate. If you see an imam or a pastor taking the vaccine, then half of the members of that congregation will perhaps have some level of confidence to say, yeah, I think if he's taking it last week and he's in church or he's in the mosque this Friday, then most likely it might be good for me taking the vaccine.
From the church angle, which I think we also saw in the movie, that the church was not only the place of that spiritual, the spiritual relationship you want to have, but then also serving as a social platform for you.
So we need to, first of all, understand that we have different cultural backgrounds and different circle of influences. Identify those areas and then see how we can maximize it.
What we need to be asking ourselves is, how can we engage in a way that we are enabling each other to think outside the box? You've talked about racism and colonialism and all that. Yes, we have that in-depth feeling of distrust, but then we still need to believe in science and know what it does for us.
Misinformation can kill. It can kill people. There's no benefit to misinformation at all. But combating misinformation in a social media age is a big challenge. But it doesn't mean that there's nothing that we can do. A lot of experts have proposed different things. And one of them is critical thinking. We need to arm ourselves, our young people, our children, to be critical, so we don't just accept information, even if it's from our loved ones, because that's where the challenge is. If your mom tells you something, you're likely to believe her, even if she's wrong, because on an everyday basis, you believe her. Being critical about how we receive information from loved ones is very important. Asking them why, how. You interrogating the information you receive. Our schools have a critical role to play. Our loved ones as well. Before you share information, you need to be sure, because your loved one is going to believe you, and they are right to believe you, because they know you love them and you care for them. So you also need to be careful in how you share information. Another way forward is around cognitive flexibility, and that's what we all need to train ourselves. Someone who is cognitively inflexible is when they have a worldview, they find it hard to shift from that worldview, and that is really dangerous, especially when they hold through a misinformation. So one of the ways in which we can help ourselves is to try to be cognitively flexible, and I think there are some trainings that can help people to be better at being cognitively flexible. But most importantly, one of the things that allow misinformation to thrive is where there is correct information and where those with the correct information are untrusted. If I don't trust the NHS and NHS is supposed to have the correct information, how am I supposed to go there? So again, building trust with communities, building credibility, especially by those in authority, saying things, doing what you say you would do, like we can see in the case of Boris Johnson, is really important. You have to do what you say, what you're saying. You can't say this and do something else, because it has implication on trust, not only on you, but also on the system and the government you're representing. So I would say building trust, building relationship, making sure we have credibility as authorities is really crucial, aside the other interventions that could be used at the individual levels.
We want the commitments that the government makes to be acted upon, because as community leaders, we have the passion, we want to see things change in our communities, but sometimes we're limited because of resources and opportunities. So if government can step up and give us those opportunities, give us those resources, the work will be done and we'll be able to do it. So we need to see those commitments being acted upon, and then we can do this together.
Beyond just engaging our community in terms of giving us food vouchers and things like that, the decisions that affect us as a community, we should also be sitting at the table making such decisions, because we understand ourselves better and we can better represent ourselves.
We are tired of people talking. We want to speak for ourselves. We want to do things for ourselves. I don't know why in every sphere people are talking to us rather than we talking about ourselves. That is the one. Another reason we're talking of healthcare, one of the things that really affect our health is mental health. And Home Office is responsible for 50 or more than 50% of our mental health.
I think it's a lot of education and being able to separate issues. And it's going to take a long time to be able to separate those issues because they are interwoven. But we need to challenge some of those concepts, unconscious, actually, some of them are unconscious concepts that we have imbibed. And the system has its own fault. We also have ours. And some have been carried over, like we have discussed all along. But we can't carry pains and hurts and keep allowing it prevent us from moving forward. And unless we challenge those and bring them to the fore and be ready to deal with them, we may not even be aware that those biases and those concepts we are carrying them along.
If you want to get included, you need to get involved. Nobody will include you if you don't get involved. How do you get involved? Get yourself organized into a unit. Get yourself involved in the institutions, and then we can move.
I have a great desire to see more work done at the grassroots level, but more importantly, see how we can build a system around the work, the partnership that we have with the grassroots community, because they have the willingness, they have the power, the eagerness, they have the local knowledge, but also they are all equally experts in different fields who can bring a lot of expertise and resources to help with public health messaging, encouraging people and getting the communities to engage with the messages that we have. So the question is, what can we do to build that piece of work or that area of work into the health system?